Namaste, everyone. Again, my name is Dr. Sunil Thummala. I'm a neurologist. I'm also a yoga teacher and a yoga practitioner. My introduction to yoga is only in the last 5 years, I would say. So, if I make any mistakes, please forgive me because I'm just again learning more into yoga. Because I feel that I'm hitting a dead wall treating patients just by medications. So, and when I explored alternative options, the one that really appealed to me was yoga. But unless you practice, you cannot preach. So that's why I started first learning about yoga. And then when I feel convinced that this actually really makes a difference in patient care, then I started to describe it to patients. And of course, since I practice it, I can describe it very well. Again, I will go over a few of the things related to neuroscience and how this may help in general health as well. I will also, let me also say, humble pranams to all my gurus. Some of the gurus I have are online gurus. I never met them personally. So again, in this modern world, we have gurus both face to face. Physically, we saw them, and some of them we only saw them online. We listened to lectures, so that all of this enhanced my understanding of yoga and neuroscience. So, in my opinion, yoga is a perfect neuroscience. Obviously, if we go more into yoga, you will learn that these are very tightly connected. But neuroscience, in the modern context, it stops at certain point, whereas yoga goes even deeper than that. So, in we talk about panchakosha. So we talk about the body, then annamaya kosha, then manomaya kosha, vijnanamaya kosha, and obviously we talk about prana, and we talk about anandamaya kosha. So all these koshas, again, inside it is your true self. So obviously we go step by step. So the annamaya kosha is the body part, and that's what neuroscience is all about, right? So it's not talking about any of the other four layers, but it is very restrictive in its understanding. We are talking only about the annamaya kosha. So I will put the body as a, obviously let me divide this body into nervous system and the rest of the body. So to me, when I was learning about, not in medical school, after I learned my med school and practicing, so my understanding of the medicine really became better when I actually learned about Vedanta and yoga. So I basically divide like mind, brain, and body. Okay, so if you think about this model, the nervous system is a connective link between the mind and body. So the entire body, whether you take a cardiovascular system or GI, respiratory, or and muscles, musculoskeletal, and so on, everything else. So it is outside the nervous system. So think that way. And then there is a nervous system at the center. And this nervous system, by somehow, at least according to our understanding, by somehow generates mind. Again, the modern medical science cannot describe where this mind is located and how it is really generated, but maybe I speculate some electromagnetic field generated by the nervous system probably generates the perception, probably generates this mind. So, in my opinion, everything is determined by the status of the mind. So, mind controls your nervous system, the nervous system then controls your body. And of course, if you have to make any changes in the body, you really have to work on the mind part as well. So the nervous system, obviously, you have central nervous system and peripheral nervous system. Imagine like, you have brain and spinal cord, which is central nervous system. Imagine that's your fuse box of your house. And then from there, all the cables go to your kitchen and everywhere, moving your fan and, lightening your light and so on. So as you imagine, those are all like your viscera. And then connecting link between that fuse box and viscera, which is everything in the house, is your nerves, which are basically like wires. So obviously those nerves are just wires; they just conduct electricity. So entire nervous system is about electricity. So if you understand electricity and neuroanatomy, you'll understand a lot about neurophysiology as well. So, and at the end of the day, obviously our entire body is just a collection of batteries. Each cell has its own voltage and average, minus 60 to minus 90 millivolts in each cell. So it's a collection of batteries in series and parallel. So, and the ancient rishis called this as a prana, and they, again, certain places, this prana is very concentrated, and they called it as chakras. Obviously, these are not something that you can scan them, but these you can experience them. That's why these are all experiential terms. So if you start searching like a scientific way, looking where is it located by scanning, you will not find them, because these are supposed to be experienced. So for somebody to make a difference in the body, one has to start understanding the neuroscience. And as I said, again, neuroscience is a conduit from your mind to the body. So I'm a photographer as well. I do a lot of photography, landscape, and sometimes I do portrait photography. I have a lot of interest in astronomy, particularly where I started is astrophotography. So from there, I went into photography. So in photography, I generally say, I use a rule, clean your stuff, clean, tune, fix. Okay, so I just use this algorithm. Whenever I start setting up anything, first thing I use clean. Okay, clean my lenses, make sure there is no speck on the lens, then tune, make sure everything is tuned, and then fix on the tripod, or fix on your hand. So clean, tune, fix. And when I was contemplating one day, I got up at 4 o'clock one day, I was in the bed, clean, tune, fix. Yoga, I felt very similar. So you start with cleaning the body and mind, and then tuning it with asanas and meditation, and then fixing it on one spot, right? Dhyanam, and then going to samadhi. So exactly similar. I was like, wow, eureka moment to me. This is basically felt like whatever I was thinking in photography also applies to the body as well. So clean, tune it, and then fixate on some object. And once you fixate on some object, then obviously the mind is fixated on object. Then the nervous system starts to rewire, because there is a interesting thing that goes on in nervous system. To some extent, goes all over the body. It is called neuroplasticity. The ancient rishis understood it. They may not have used the word neuroplasticity, but they understood it conceptually, and they try to use it to the advantage of the body and mind. So this neuroplasticity is whichever way you direct your mind to, and whichever one you do more often, your nervous system gets rewired in the same way. That's how physical therapy and so on, they are done to rewire the brain. So, and I think again, the meditation brings the concept of focusing on removing your senses, blocking your senses, focusing on one part. And by doing so, you are activating your vagal nerve. So in neuroscience, we have something called vagal nerve stimulator. So I was at one of the conference doing, again, this is regarding vagal nerve stimulator training. And some of the people who presenting there were like in the main clinical trial that led to the approval of the VNS. So I was curious, and I asked, like, how does it work? And the physician there said, we don't know. So I told him, let me give you some idea to see if it makes any sense to you, because I was not sure if that. So I told him meditation improves vagal tone, and by improving vagal tone, we know meditation controls epilepsy. So by doing the vagal nerve stimulation electrically, are we doing the same thing, controlling epilepsy by increasing vagal tone, which meditation does without any expensive gadgets or surgeries. And interestingly, he said that's one of the perfect explanation, or best explanation he has heard. So again, most of the modern science, I think we are using therapies, some of them blindly, but they have some deeper connection to yoga. So obviously, my goal obviously is to work with similar-minded institutions to see how can I help them to bring the science of yoga into neurological practice, day-to-day neurological practice. In my opinion, the more we use yoga, the better we will do to the society, cut down the cost, and not just short-term benefit, but yoga, in my opinion, provides a long-term benefit because it alters the brain chemistry, brain wiring by neuroplasticity. whereas regular physical medications, they just treat the symptom. Like I generally give this analogy, like if you have a crack in the wall, it is just putting some sugar coat or spray on the crack in the wall, but it's not really addressing the foundation shift that is happening, that is leading to the crack in the wall. But yoga is not only addressing the crack in the wall, but is also addressing the foundation shift. Yes, the foundation shift takes time for us to address, but it is a lasting benefit, and compared to just a pill, which is a transient benefit. So again, I'm just going to go only superficially. So there are so many diseases where I find like Parkinson's disease, Alzheimer's disease, and of course multiple sclerosis, traumatic brain injury, peripheral neuropathy, autonomic neuropathy, very big, where I believe, in my opinion, the yoga, all aspects of yoga, Ashtanga yoga, really help. And I think we need to do more to bring this awareness to the community and connect the science of yoga to the science of neurology, to help the again our patients. That's basically my intent, and certainly I'm happy to collaborate with any institution that share the similar viewpoint.